morning, everyone. It is an honor to be here in this beautiful city, although no one told us from Boston that it is winter here and not summer. So enjoying, but a little bit chilly. This morning, I am going to speak with you all about using integrative therapies and exercise and other types of non-pharmacologic interventions to help our patients feel better during and after their cancer treatment. So my goals, let's figure this out, really are to talk a little bit about what are integrative therapies, what does that word mean, and what is the evidence that these types of therapies can be helpful to patients with cancer. And then I'm going to talk a bit more about exercise, which is somewhere really in between an integrative therapy and more conventional medicine, and what we know about the value of exercise in people with cancer. So we'll start off by what are integrative therapies. There have been many different terms that have described these types of treatment modalities over the years. Alternative medicine, complementary medicine. The term that people usually use now is integrative medicine, and that really focuses on therapies that are designed to treat the whole person and use both conventional treatment as well as more unconventional things like diet, exercise, massage, and acupuncture. And the key concept here is the integration, that you're using all the different potential modalities to help support your patient. So the goal really is to treat the whole person and not just focus on treating the disease they have, in this case, cancer. So there really isn't a standard definition of what an integrative therapy is, and in many ways, this could be almost anything that's not a drug, surgery, or radiation. Common examples of integrative therapies are things like acupuncture, massage, yoga, music therapy, and art therapy. But there are definitions that are much broader and include really any kind of special diet that someone eats, any exercise they do, prayer of any sort, or spirituality. So I think it's important to know that if you're looking at a study, you should look at, well, how are they defining their integrative therapies, because the list can be very, very broad. One of the things that we do know is that many patients seek out integrative therapies after being diagnosed with cancer. That's true in the United States. That's also true in Brazil and around the world. Studies have demonstrated that anywhere between 60 and 90% of cancer patients are using some type of integrative therapy. That's a pretty broad range, and it kind of gets back to, well, what are you counting in that list? But regardless, it's a lot of the patients that we see. For example, there was a study that looked at women who were living with advanced breast cancer in the eastern United States. It's about 230 women who had metastatic breast cancer, and they found that 3/4 of these women were using some type of integrative therapy. And this list was actually quite tight. It didn't include things like diet and exercise. They found that almost 1/4 of these patients were using 3 or more types of integrative therapies. And here you can see what these women were seeking out. Almost half of them were working with a massage therapist. Many of them were working with an acupuncture provider, an energy healer, using supplements. And I think the important thing about this also is that many times, although our patients are doing these things, they may not be talking to us about them. And so it's important when you're seeing your patients to ask them about what types of other things they're doing. I think there's less concern about something like massage, but perhaps a bit more with some of the supplements that people may be taking, that there could potentially be some interaction with other treatments that you're giving to patients. One of the questions that I'm often asked is, I am a breast medical oncologist and I give people chemotherapy and things like that too, and we all know how many advances there have been in cancer care over these last years. One thing people often ask me is, why is there so much interest in these integrative therapies at a time when the conventional treatments that we have for patients have gotten so much better in cancer? Part of the reason for that actually is that as our treatments have gotten better, there are more and more people who are living and thriving after they've been diagnosed with cancer. So in the United States alone, there will be an estimated 18 million cancer survivors by 2022. One of the things that is really quite incredible, and Dr. Partridge, my colleague, will talk a lot more about survivorship and all of the issues that go along with that later, but the number of patients who are living after a cancer diagnosis, either with persistent disease because of some of the new therapies like immunotherapy and targeted therapy where people are living much longer, or having been treated for an earlier stage malignancy, that number of people has grown very, very quickly over a short period of time. And we are just still figuring out exactly all of the different implications of being a long-term cancer survivor, either on treatment or off. One of the things that we do know, however, is that even for the patient who had treatment for their breast cancer or colon cancer and they're free of disease, many times they are not free of side effects. And the treatments that we use for cancer, although they have become more successful, continue to have many, many toxicities for our patients that at times can last years and years and years after their diagnosis. One example of this is fatigue. I think we all know in treating cancer patients, during and even after they finish their therapy, many patients complain of fatigue. This meta-analysis looked at 27 studies, almost 14,000 women who had been treated for early stage breast cancer. And it showed that about 40% of patients had fatigue at some point during their therapy, and a full almost 27% of them had persistent severe fatigue in the months after their cancer diagnosis. But one of the things I think that was most surprising is if you look in this box, and the studies are a little bit heterogeneous because they define this severe fatigue in different ways, but studies found that anywhere between 15 and 40% of patients continue to have this level of fatigue 6 or more months after they finish their therapy. They found that some of the risk factors for having this fatigue that persisted, not surprisingly, were people that got more treatment. So if you got chemotherapy, if you had higher stage disease, but they also found that psychosocial factors were associated with this. People who weren't partnered, people who had less economic resources were also at more risk of having fatigue that lasted after they finished their therapy. There are also physical effects of cancer treatment that can last for many years after cancer diagnosis. One of these things, looking at cardiorespiratory fitness and functional status. Studies have shown that women with breast cancer often have lower cardiorespiratory fitness when they're diagnosed with breast cancer. And so what you see here on this slide was a large analysis of about 2,000 women with early breast cancer and about 2,000 age-matched controls. And they showed that the women before their treatment, they had lower cardiorespiratory fitness compared to normal controls. After treatment, not surprisingly, their fitness and functional status diminished from where they started before their treatment. But I think the thing about this study that was the most interesting was that these decrements in cardiorespiratory fitness lasted for more than 7 years after women were completed with their therapy. And they were the most pronounced in women who received multimodal treatment with chemotherapy, radiation. And so there were long-lasting psychological and physical effects of cancer treatment. There are a number of reasons why people find integrative therapies appealing as they seek solutions for some of these longer-term issues that arise from cancer treatment. They don't require a prescription. They're generally less likely to have side effects, especially more of the physical modalities like yoga and massage. People view them often as more natural. And I think one of the main things that leads people to seek out these types of therapies is that they're also under their control. I think as physicians, as providers, taking care of people with cancer, we recognize that there are so many things that we do to people. We give them medicines, that give them surgery. People often feel like they don't have a lot of control over their lives or over their illnesses during cancer treatment. And this is something that many people feel that they can do for themselves, which can be very empowering, which is a good thing, but do these things really work? Is there evidence that pursuing integrative therapies is actually helpful for people with cancer? And I think as a general overview, there are not the types of studies supporting the use of these treatment modalities that we are often used to as oncologists. There are not studies of thousands of people comparing one therapy to another. And there's also no evidence that these types of treatments, acupuncture, massage, actually treat cancer in people. But there is growing evidence that they can treat the side effects related to the cancer itself and related to cancer treatments. I'm not going to try to go through all of the studies that support the use of these treatment modalities, but I'm going to provide a couple of examples so that you get a sense of where the research is really starting to support, especially acupuncture and yoga, which are the two integrative therapies that have really been the best studied in people with cancer to date. So, how many of you treat women with breast cancer? Me. Okay. So most of you know that when we give women aromatase inhibitors, one of the things that they complain a lot about are joint pains. This is one of the most common side effects that occurs for women with breast cancer, and it's one of the reasons that women stop taking these medicines. About 50% of patients start to develop joint pains within the first month of taking these drugs, and they're really one of the main reasons why people stop taking them. And we know that if you don't take your aromatase inhibitor, it doesn't work. So we really were trying to find ways to help alleviate joint pain in women who are taking aromatase inhibitors, and there's not a lot of proven therapies that have been shown to really help women stay on these medications. So this was a large study that was done through the Southwest Oncology Group in the United States. So this was a multi-center cooperative group trial that looked at acupuncture as a treatment for joint pain in women who are taking aromatase inhibitors. So to join the study, a woman had to be taking an aromatase inhibitor, and she had to have joint pain that was fairly significant. So at least a 3 on a 1 to 10 scale. The study enrolled around 200. Is everything okay? Can you hear me? Okay, sorry, I wasn't sure. The study enrolled 226 women, and it randomized them to real acupuncture, sham acupuncture, which we'll talk about in a minute, or a waitlist control group who knew they were not receiving acupuncture. And this really gets to one of the things that's a little bit tricky about doing these types of studies is that it is oftentimes when you're studying drug X versus drug Y, we have placebos. Placebos can be hard if you're thinking about something like massage or yoga or acupuncture. So they've developed sham acupuncture, which basically means that there's two ways of doing that. Either you put the needles in the wrong places, or you use needles that don't actually puncture the skin. And in this study, they used both of these things. They used shallow needles and they put them in areas that they did not think would actually affect acupuncture. So one group got real acupuncture, one group got sham acupuncture, and then there was a waitlist group who did not get any treatment at all, but was allowed to get acupuncture at the end of the study. And what they demonstrate, so the patients who took part in this study were typical patients taking aromatase inhibitors. They were on average age around 60. Most of them in this study were non-Hispanic white. I think the things that are important, so they had on average been taking the aromatase inhibitors for about a year. So these were women who were stuck with the aromatase inhibitor despite the joint pain they were having for a year. And they reported at baseline about 6.5 out of 10 in terms of the pain they were having from the aromatase inhibitors in terms of their joints. So this was pretty significant pain that these women were experiencing. And what the study showed was that the true acupuncture was superior to both the wait list and also to the sham acupuncture. And when you looked at a 2-point improvement in joint pain, you can see that the true acupuncture group had a much more significant benefit than either of the two comparison groups, which is very exciting to see that the acupuncture actually was not only beneficial in women who didn't think they were getting acupuncture, but in women who believed that they were also receiving acupuncture, that there was a benefit of this program. So this is probably the largest and the best controlled study to date showing the value of acupuncture on a side effect in breast cancer patients. But there are actually hundreds of other smaller acupuncture studies looking at the value of acupuncture for other side effects. This was another study, a bit smaller, so 120 patients who were having hot flashes from tamoxifen or aromatase inhibitors. Again, a lot of these studies have focused on breast cancer patients for a variety of reasons. The reason I'm including this study was I think it had an innovative design that it not only compared acupuncture to sham acupuncture, but it compared it to gabapentin, which is a medication that we often use to treat hot flashes in women with breast cancer. And so there were 4 groups. There was acupuncture, sham acupuncture, gabapentin, and placebo. And they were looking to see which of these modalities resulted in the best control of hot flashes. And as you can see here, the acupuncture and sham acupuncture groups had significant benefits in terms of hot flashes as compared to both the gabapentin, which actually did the most poorly of any of the modalities in this study, even worse than placebo. And there were also far fewer adverse events noted. People complained of side effects with both the gabapentin and the placebo, but not as much with the acupuncture and sham acupuncture. So small studies, but I think that there are now many, many different potential uses for acupuncture in patients who are being treated for cancer. There have been studies looking at cancer-related fatigue, neuropathy, nausea, anxiety, and stress. So there is growing literature suggesting that acupuncture may be helpful for many of the common side effects that our patients experience during and after cancer therapy. Yoga really is the other integrative modality that is starting to be studied in larger groups of cancer patients with some well-controlled studies. Now, sham acupuncture is definitely, I think, a relatively reasonable comparison to real acupuncture. It is harder with yoga. There is not a sham yoga that has been developed so far. I'm not sure what that would look like. These studies are a little bit more complicated, and especially because a lot of the things we're looking at is how do people feel. You can definitely make people feel better if they think they're doing something to help themselves. So studies have kind of tried to look at different ways of adjusting for that. This was a trial that enrolled patients who were having sleep disturbances after cancer treatment, which is very common. Obviously, a lot of our patients have trouble sleeping both during and after their cancer treatment. This was a big study. It enrolled more than 400 cancer survivors. It was this time a mixed group, although about 75% of them were breast cancer survivors. And they were randomized to a structured yoga program called YoCast. So this is the other thing that's a little tricky about studying yoga, is that there's so many different kinds of yoga. There's hot yoga, there's power yoga, there's hatha yoga, there's flow yoga. This was a yoga program that included gentle hatha and restorative yoga with breathing and mindfulness. So a fairly standardized yoga. And what they found was that yoga practice led to improvements in a lot of their sleep outcomes. There was a statistically significant improvement in overall sleep quality, and there was also significant improvements in things like daytime dysfunction. There was a marginal benefit in reduction in the use of sleep medications, showing that the yoga program was helpful for these patients who were suffering from sleep disturbances. But this study compared yoga to nothing. The next study that I'm going to briefly talk about looked at a different type of comparison group, again, trying to figure out, is this really a benefit of yoga, or is this just a benefit of doing something? And so in this trial, which was a bit smaller, but enrolled women as they were starting radiation for their breast cancer, randomized them to yoga, to stretching, or to a waitlist control, to kind of, again, see if it was being a part of a program that was helpful or something specific about the yoga. Patients participated in these studies or in this intervention all throughout the radiation course. And what they found, interestingly, was that both yoga and stretching led to an improvement in fatigue. And you can see there that the gray line on the top is the control, the bottom, the blue, is the yoga, and the yellow is stretching. So both of those programs actually helped with fatigue, but only yoga helped with physical functioning. And the piece that was very interesting about that was that the improvements in physical functioning from yoga actually lasted for more than 6 months after people finished the program. So again, showing that there could be benefits, but it's not really clear in terms of fatigue, whether it was just being a part of a program or something specific about yoga. So I think as an overview, and we're not going to go through any more small studies, but I will assure you that there are hundreds of them looking at things like music therapy, art therapy. I think in general, this is not the type of high quality, large studies, evidence of most cancer therapies, but it is starting to emerge specifically in the area of symptom management that these types of programs may be helpful for your patients. And I think that over the next years, there will likely be more and more studies, especially of acupuncture and yoga, trying to look at what types of programs are the most beneficial and which patients may benefit most during and after cancer therapy. So I'm going to transition a little bit to exercise, which is in some definitions included in integrative therapies, but I think there's been a lot of research over the last years that suggests that exercise, unlike integrative therapies, may actually have a benefit for cancer-related outcomes themselves. So there is a lot of evidence that suggests that fitness and physical activity are linked to both the risk of developing cancer and to outcomes in people who are diagnosed with early stage disease, especially for cancers like colon cancer, prostate cancer, and breast cancer. This graph that you see on the slide here looked at a meta-analysis of 10 different studies looking at cardiorespiratory fitness measured through stress tests. So these were people who had stress tests for other reasons, but looked at how that related to their long-term cancer-related outcomes. So this was a mixed group of cancer patients. Again, it was about half breast cancer, about a quarter prostate cancer, and then the rest were other mixed cancers. And what they found was that patients who had high cardiorespiratory fitness, so who were fit, had a much lower rate of cancer-related mortality. So not dying from heart disease, but had a much lower rate of cancer-related mortality compared to patients with low cardiorespiratory fitness. There have also been studies that have looked at exercise patterns after cancer diagnosis and how that relates to the risk of cancer recurrence and mortality. And this was a big meta-analysis that was published looking at about 30 of these studies last year. And what it demonstrated was that for women with breast cancer who exercised regularly, and most of the time these people were walking for an average of 3 to 5 hours a week, this was sort of the high exercise group, had about a 40% lower risk of cancer-related mortality compared to women who weren't doing anything. Interestingly, they found almost exactly the same lower rate of cancer-related mortality in colon cancer and in prostate cancer. So individuals who are more active after they're diagnosed with cancer seem to have a better outcome. Now, these are not randomized trials, and we certainly know that people who are doing better are more likely to exercise. So I wouldn't take this as direct cause and effect evidence, but there's very consistent evidence that both fitness and physical activity are linked to better cancer-specific outcomes. We don't have data right now that taking your patient who's not exercising and putting them on an exercise program will reduce their risk of cancer-related mortality, but there are 2 big studies that are going on, one in colon cancer and one in advanced prostate cancer, that are actually studying the impact of an exercise program after diagnosis on recurrence and mortality. So hopefully over the next few years, we will have evidence of whether exercise can actually be a part of treatment to improve outcomes. While we're waiting for that evidence, we do have a lot of research that's been done that shows that exercise can help alleviate symptoms. And these studies are actually bigger and a bit more robust than the evidence that we were looking at in terms of integrative therapies. So at this point, there have been more than 1,000 studies that have looked at the impact of exercise programs after cancer diagnosis, both during treatment and after treatment, and how that affects physical and psychosocial outcomes in cancer patients. There was a large review of this that was done almost 10 years ago. They're in the process of updating this, and having been involved in both of these processes, in 2010, when we reviewed this evidence, there were about 120 studies. When we reviewed this last year, there were more than 1,200 studies. So it shows you how quickly this area of research has grown. But even back when they did the initial review of this 10 years ago, there was pretty consistent evidence that exercise makes people feel better. It's not a big surprise, but that it also led to reductions in things like fatigue and improvements in fitness and muscle strength. Some of the work that's been going on has looked more specifically at some of these outcomes, and this was a Cochrane review of 15 trials that looked at exercise to improve cardiorespiratory fitness. So we had looked at a strong connection between cardiorespiratory fitness and cancer-related mortality, and we know from these trials that you can improve cardiorespiratory fitness by putting someone on an exercise program. This has been shown really within cancer and without, but I think there is no doubt that if you get somebody to exercise regularly, that is going to improve their fitness and their physical functioning. It will also reduce their fatigue, and I think this is something that sometimes is counterintuitive to patients and to doctors, but the studies have demonstrated that the best antidote for fatigue is actually exercise. It can be hard to get people to start exercising when they're tired, but there have now been more than 50 randomized trials, both during and after cancer treatment, that have shown that if you get someone to exercise, you can actually reduce their fatigue more effectively often than you could do so with any kind of medication. There are also studies looking at some of the more specific toxicities that we already talked about. A trial that Melinda Irwin, who's an exercise physiologist at Yale, and I led, looked at the impact of exercise on joint pain, again, in women who were having joint pain from aromatase inhibitors. This study enrolled 120 women who were having joint pain and showed a significant improvement in joint pain at 1 year from taking part in an exercise program that included both walking and strength training using light weights. So showing some very specific benefits of exercise in cancer patients. But what about exercise and risks in patients, especially in breast cancer? We've often worried about whether weightlifting exercises are safe in women after they have axillary surgery. And for many, many years, we used to tell women, don't ever use that arm, don't ever lift anything heavier than 20 pounds. That wasn't necessarily based on a lot of research, but it was something that for many years persisted in the advice that we gave to women, until about 5 years ago, when there were 2 studies that looked at whether exercise may actually be helpful in preventing and treating lymphedema. So the first of these studies, which was published in the New England Journal, enrolled women who already had lymphedema. 140 women who had pretty stable lymphedema. Stable meant that they hadn't gone to physical therapy or occupational therapy for 3 months, and they hadn't had any recent flares of their lymphedema. They randomly assigned patients to a 1-year weightlifting program or to usual care, which did not include any weightlifting. And their primary objective was to measure the arm and see whether it got larger, and also to look at how many lymphedema exacerbations these women had during the exercise period. Now, the program they used was pretty specific. Patients worked with a trainer for 3 months, and then they did exercise on their own for the next 9 months. They did both upper and lower body strength training. They started with the very lightest weight you could, and they had a very structured way to slowly increase the weight that women were lifting with their arms. They also used compression sleeves during their treatment program, and they took a break from the strength training if they had a lymphedema exacerbation. The women who took part in this study, I'm not going to go into too much detail, but I think it's important to recognize these were long-term breast cancer survivors. So they were on average more than 6 years after their cancer diagnosis. They most of them had had very extensive axillary surgery, and most of them had also had radiation. So this was a group, again, who had pre-existing lymphedema. And what they found was that there was no difference at all in arm volume in women. This study was really designed to test whether this was dangerous for women to do this strength training. And so it was set up so that if there was an increase in arm volume in women who did all this weightlifting, looking for equivalents, and they found that there was no difference at all in arm volume, but they actually showed that women who took part in the weightlifting program had a lower risk of having lymphedema exacerbations during this period of time. So rather than the weightlifting being dangerous, it actually prevented exacerbations of lymphedema in women who already had lymphedema. And there were no serious injuries that were reported. So the number of lymphedema exacerbations was decreased from 29% during the 1-year period to 14% in women who did the strength training. So the group then went on to look at, well, if exercise can prevent lymphedema exacerbations in women who already have it, can it prevent lymphedema altogether in women who don't yet have it? And so this study enrolled 154 women who did not have pre-existing lymphedema. In order to take part in the trial, women had to have at least 2 lymph nodes removed. So it included both women who had sentinel lymph nodes and women who had full axillary dissections. It again randomized women to that same weightlifting program that we talked about. The only difference was that women did not wear a sleeve. These women did not have lymphedema, so they did not wear any kind of compression garment during the treatment. And again, it showed that the weightlifting program actually was beneficial in preventing lymphedema in these women. So in this course of the 1-year program, for women who did not do the weightlifting program, 17% of them developed lymphedema. If they did the weightlifting program, 11% of them did, which is not a big difference. But when you think about the fact that we were previously telling women that exercise caused lymphedema and showing that actually the converse was true, really led to a rapid and significant change in the way that we counsel women with breast cancer about weightlifting. It is important to recognize this was a very structured program. Women did work with a trainer for the first few months, but I think really a hopeful message for women that the right answer is not necessarily don't ever use your arm again for any kind of exercise. All right. And so given all of this evidence about the value of exercise in patients with cancer, there are a number of groups that provide guidelines for how much exercise and what types of exercise. The American Cancer Society has published for the last several years nutrition and physical activity information. If you'd like to hear about diet, I will be talking about it in the breast session later today. But they do recommend that people start engaging in exercise as soon as they can after cancer surgery, and that they try to engage in at least 150 minutes of moderate and vigorous aerobic activity, as well as 2 strength training sessions a week. The other group that has really provided very specific information about physical activity for our patients is the NCCN, which in their survivorship guidelines has a whole section on how do you get your patients active, where do you start if they're not doing any activity, and that can be a helpful resource to you and your patients going forward. So the last thing I want to finish with is just a little bit of a thought. And one of the things people ask me a lot is, we all know exercise is beneficial, and what harm could there be in people doing acupuncture, massage? Why is it really important that we actually research this? Why can't people just go out and do it? And I think in some ways that is a good question. All of these things are freely accessible. They don't require prescriptions. But I do think that it is important that we really understand what the value of these types of modalities is. And I do also think that it's important we recognize that just because something doesn't have a prescription doesn't mean that it can't potentially be harmful. And I'm going to just finish by talking about a large trial that was conducted in the United States more than a decade ago now, looking at whether supplements could reduce the risk of developing cancer. Supplements in the United States, you can just go to a drugstore and buy whatever you want. People often believe that these things can treat cancer or can prevent cancer. And so this study was designed to look at whether selenium and vitamin D could actually prevent prostate cancer. There was some evidence from animal models that maybe these types of supplements could be helpful in cancer prevention. And so this was a huge study. It enrolled 35,000 men who did not have prostate cancer and randomized them to selenium and a placebo, vitamin E and a placebo, both supplements, or to double placebo. And the primary endpoint was looking at how many of these men developed prostate cancer. The study was stopped early in 2008 when the DSMB determined that it was very unlikely that these two drugs, these two supplements, would actually reduce the risk of prostate cancer. And then when they stopped it, they did find that there was actually a numerically higher risk of prostate cancer in the men who took vitamin E. It was not statistically significant. They found that actually taking selenium seemed to increase the risk of getting diabetes for reasons that people weren't clear about. And they didn't see any evidence of a change in overall cancer. And you can see in this graph here, all those curves of the two supplements by themselves and with placebo were pretty much identical. So this was why the DSMB said, well, it's almost impossible that this would actually ultimately be shown to have a benefit. But as they followed these patients longer, and at this point they had all stopped taking these supplements, they found that in fact, taking vitamin E increased the risk of developing prostate cancer by 17%. And this was a randomized trial, so these men were the same in all other regards, except for the fact that some of the men were taking vitamin E. And so they also found that there was a slight increase in risk in the selenium group that wasn't statistically significant, but certainly absolutely no benefit from these supplements. And then this is one of the reasons why I think it is really important that we don't just assume, what harm could there be in things that don't require a prescription, and we really do study them the same way that we study the other treatments that we use to treat cancer. So with that, I know this was sort of a very high-level overview of what's becoming a very large area of research within cancer. I think that the reality is that a lot of our patients are using these modalities. It's important to kind of be able to guide them and where is there really evidence that these types of therapies are beneficial. I think exercise is certainly in a little bit of a different place than things like acupuncture and yoga in terms of its value in cancer patients. And I think that overall, we need to continue to research these fields to figure out how do we give our patients good guidance about what they should be doing during and after their cancer treatment. And I just want to leave this with, we'd love to have you all come and visit our center at Dana-Farber, where we offer exercise and nutrition and integrative therapy services for our patients. Thank you very much.